Hi everyone, this is Doc Lee. Today I will talk to you about a very important reason the owner bring animal to a clinic, that is vomiting. So I mostly want to talk to you regarding the importance of history exam in making a right diagnosis. Um, so first of all, I will talk to you regarding vaccination. So for a dog less than a year old, if not vaccinated, and all of a sudden become lethargic, not eating, keep vomiting, and also sometimes have diarrhea, the first thing I would think about is a parvo. Okay, so and then I will probably also ask you, is there any thing the dog might ingested, something like a toy, or a bone, or a sock. So if that is the case, I probably will thinking, we might want to do some X-ray and make sure nothing, like a obstruction in the GI tract. If that is the case, surgery might be needed. Okay, so and then is the pet also still have appetite or not? Okay, so if the vomiting only like one time or two times, they're probably not that important. Maybe something up the stomach, or maybe the animal eating too fast. So but if the dog is not have any appetite, not even the favorite food, not even keep the water down, then it's more concerning. Another question is the dog have any diarrhea or not? So, or any poop at all? If it's no poop, when was the last time the dog poops? Is the poop dry, like pellet? Is there any blood or mucus in the stool? That's all very important. In this case, if you have like a photo or video, that will be very, very helpful for veterinarian to make a right diagnosis. The age of the pet is very important. So if you bring me a senior pet, like a dog with over 10 years old, probably the first thing I will ask is there anything else going on with the pet? Something like the kidney or liver failure, or like a diabetes. I will ask, that's probably the reason why the dog is not feeling well, other than something going on with the GI tract. So in this case, if you have a recent blood work, I highly suggest you bring a copy, because if you do not have a copy, the veterinarian most likely will require repeat blood work for senior pet. Okay, so the nature of the vomiting is very, very important too. Is vomiting is mostly food, undigested food, or bile, or foreign material. So if you see part of the foreign material, like a piece of bone or some piece of toy, then most likely there's more stuff in the GI tract. Then I'm thinking maybe something obstructed. Okay, so other confusing like condition, like coughing, regurgitation, is also confusing to the owner sometimes. Like one time I have a dog with coughing. That dog had kennel cough. Okay, that dog like coughing so much, it started gagging. The owner mistakenly thinking the dog is vomiting. Think maybe something is stuck in the dog's throat. Because they have financial, they want to put the dog down. So I end up treating the dog with kennel cough. The dog is doing pretty well. So it's not really vomiting. In this case, it's coughing and gagging. Regurgitating. Regurgitation is pretty confusing to owner too. The major difference between regurgitation and vomiting is vomiting is have like an abdominal effort. While regurgitating is passive, the food coming out. So if it's regurgitating, so most likely it's something going with the esophagus. Like something going with the esophagus, like stricture or some foreign material in the esophagus, or there's some other congenital condition causing the stricture of the esophagus. Okay. Any other pet in your home, if you have another pet showing a similar symptom, like still vomiting, not eating, then it likely something contagious or poison. Both dogs exposed to, causing the similar symptom. Okay. Is dog spay or not? If you are a senior pet, like senior intact female, after in heat, all of a sudden become lethargic and not eating, and sometimes you can see some purulent vaginal discharge, then I'm thinking, there's a condition called pyometra. The other word of pyometra is an infection of the uterus. That condition is a surgery as soon as possible. Okay, breed is very important. So if you bring me a large breed, something like a Great Dane or German Shepherd, after eating, and then their stomach become very bloated, acting painful, they try to throw up something but not able to throw anything up, then the GDV is very likely. GDV stands for gastric dilatation volvulus. This is a critical condition, needs a surgery correction ASAP. If the dachshund bring in for vomiting bloody stool, then it's more likely to be HGE, meaning the hemorrhagic gastroenteritis. So most time there is a history of feeding human food, or the dog pick up some human food on the floor and causing the symptom. So exam is a very important tool. There is a big difference between a veterinarian with experience or untrained, inexperienced veterinarian. Okay, so sometimes for small dog or cat, you can palpate the foreign material directly when do abdominal palpation. I remember one time I was able to palpate like an acorn in puppy's intestine directly. I know the dog most likely eating something by my feeling, so no need X-ray. Okay, so if there's a cat or older dog have big abdominal tumor, I can also palpate as well directly. So without needing the actual ultrasound. Rectal exam, okay, so also provide us a lot of good information. So by rectal exam, I can know, what the stool look like. Okay, so whether it's diarrhea or dry, what's the color of stool. Sometimes I can dig out some foreign material directly from the rectal exam. Okay, so and whether the dog is painful or not. Okay, so sometimes you can also feel the other structure as well, like an anal gland, or for male dogs, the prostate, or for older pet, you can feel the spine as well. Anyways, the rectal exam also gives you a lot of information as well. In summary, today I mostly talk to you the importance of history exam for making the right diagnosis for dog presenting with vomiting. So as an owner, before you bring your pet to your clinic, you should prepare those questions which help you make a right diagnosis in an efficient way and economic way. Thank you.
Here is the key.
The surgery I give short SX. HGE stands for hemorrhagic gastroenteritis. FB stands for foreign body. Thank you. Please subscribe if you like my video.